the attitude, the doctrine of the UK was to plan for the consequences of a disaster. Can we buy enough body bags? Where are we going to bury the dead? And that was completely wrong. Of course, it's important to have that in case you fail to stop a pandemic, but central to pandemic planning needs to be, how do you stop the disaster from happening in the first place? How do you suppress the virus? By not preparing to stop a pandemic, and worse, by explicitly stating in the planning that it would not be possible to stop a pandemic, therefore a huge amount of other things that need to happen when you're trying to stop a pandemic didn't happen, and we had to build them from scratch when the pandemic struck. For instance, large-scale testing did not exist, and a large-scale contact tracing did not exist because it was assumed that as soon as there was community transmission, it wouldn't be possible to stop the spread, and therefore, what's the point in contact tracing? That was completely wrong, and in my view, is the absolutely central lesson. Is, of course, the difference between a flu and a coronavirus is important, but it is not nearly as important as getting the doctrine right, so in future we're ready to suppress a pandemic